I went through the test and I realized that we did not talk about this. The treatment for carbon monoxide poisoning is immediate. 100% oxygen, non-rebreather mask. It cuts down that binding of carbon monoxide like from 4 to 6 hours to an hour and a half. That's what we want. So you can't smell this gas. You can't really taste it. I'm trying to think where this was. It was in New Jersey, I think. It was a pool party. Firefighters, EMS got called. They showed up. There's all these kids laying on the ground. Pool party. Folks don't just pass out 20 at a time. That's very suspicious. There was a pump for the pool that was malfunctioning, and it was spraying carbon monoxide. Well, children hits us how? In our emotions. And so the firefighters went running in, and then all of a sudden one of the firefighters went down. They had the good sense, and that would be hard to do, to back out and not think they drug him out with them. And then they started looking, and now there's like 10 kids out. So now they're going to run in as they got their breathing apparatus on, grab these kids, and drag them out. You don't know that you're being exposed. If it's mild to moderate, headache, dizzy, nausea, vomiting, and you get confused. When it gets severe, loss of consciousness, seizures, this is a post-mortem sign. And I know they always put this is a very rare, very, very, very late sign at dead. Yeah. You're going to be in the morgue, you go, oh, look at that cherry red sign, coma. I'm going to combine these back into the whole thing. I did download these separately just for, I know it's confusing when I do this, and I hate when I do this. How do you assess the patient that's on fire? You don't. You put them out. And I had to put
I feel like this is sorry, but
one of my paramedics. I am one. I love them to death. How do I take their blood pressure? Where do I put the tourniquet if they're bleeding on their neck? Come here, let me take your blood pressure around your neck and I'll show you. The house is on fire and they're in that room. Where do you want me to assess them? Outside somewhere. Drag him outside. He's on fire. Yes. It's fine. This is fine. Put them out. Remove the patient from the source. Do not jeopardize your safety, because that firefighter that went down, now he can't take care of anyone, and his co-workers are going to try to take care of him. 100% oxygen, non-rebreather mask, right freaking now. Reduces a half-life 4 to 6 hours, 60 to 90 minutes. I like those odds. It's always ABCD, exposure, source, how long. Now, if they come in and they're seizing and in a coma, are we going to put a non-rebreather on them? No. What are we going to jump to? Right. They ain't got no patent airway. Their disability, their GCS is probably a 3. They can't control their airway. They need to be intubated. High flow oxygen immediately. Intubation, cardiac, LOC. We want to know the exposure details. Were they in a enclosed space? How long? If it is a bigger hospital, I think they can do that there. If it's a send out, it ain't gonna do you no damn good.
The classification.
And then, we didn't even talk about chemical burners either. We did talk about the acidic and alkaline, and I could not remember why alkaline was worse. This is why it basically liquefies the skin and causes necrosis, pain, discoloration, and it might be delayed symptoms. Has anybody ever, some of the metals that we deal with in chemistry are solid, right? Or, that's stupid. They're soft. And when they contact water, what happens?
It burns.
They catch on fire, and if it's a big enough piece, it explodes. So, if a piece of that is on you, are we going to irrigate that? No. So, if there is a dry powder on the patient, brush it off first. But the standard is, you've got to decontaminate the patient. If their clothes are soaked in diesel fuel, get their clothes off. Don't just sit there and leave them. Don't just sit there and leave their clothes on them if it's soaked in this contaminant. Brush off dry powder. Irrigate immediately with copious amounts of water or saline. Take those contaminated clothes off. And if you're in the emergency room and they've got all these clothes on with this noxious fumes coming off, you're gonna take their clothes off and drop it right there, right? Everybody in the damn emergency room is gonna pass out. And that's another thing. If you are outside and you are irrigating this, you need to be cognizant of what? Where's that water going? Why?
You don't want some of this stuff in the water stream?
Well, not only that, what if there's like 30 people that this happened to, and I'm decontaminated down here, and Elena's down here with all the children, and my crud is washing down there and getting all over the children. You need to be aware of where your dirty water is going to. But that's why we have what? Specialized decon rooms. If you've never had hazmat training, you don't know those things. That's why you call people that have, right? We can all do this. Brush that powder off, flush them with copious amounts of water, and if you don't have something to put that clothing in, have y'all ever got a lot of amount of gasoline or diesel on you? Oh my God, it's awful. If you can't get them in an enclosed space or something, then you take it way off so everybody doesn't get exposed to those fumes. Airway. What's another thing that happens with chemicals? They get splashed what? In your eyes. One of the worst chemical burns I've ever seen. The eyes of car battery exploded in his eyes. This is just a question. Who's the emergency room? There's specific something in the emergency room that we use to irrigate the eyes. Does anybody know what it is? Starts with an M. Morgan lens. It's a bigger, it kind of looks like a contact lens, and it has a tube that runs off of it that you attach fluids to. That's what it's for. Now, you can kind of jimmy rig some stuff up there, and you can actually hook up nasal cannula to a bag of fluid and you run it down. You need to be careful. Why? If this eye has the fluid, how am I going to turn their head? I don't want it to run to the unaffected eye, right? And I know that sounds stupid, but why would I be saying it? Is like that little pack that says don't eat this. They wouldn't be writing that on the bottle if somebody hadn't tried to eat it, right? Y'all know that's the truth. Don't eat this little silicone pack. Oh, look at this. That looks tasty.
I don't know, they just said creative.
Has anybody seen a bad burn this semester?
Not
Has
really.
anybody seen a bad burn this semester?
Oh, not this semester,
In
no.
my-
Yeah, yes, yes.
What kind of burn was it?
It was weird because it was both like a, full thickness burn and a, electrical burn. He fell off of a light post. Something fell on him and burned like his whole shoulder, so it was both.
Well, I mean, does that happen often?
Yeah.
I mean, you might have an explosion, chemicals, fire, and trauma. So it's not just always thermal, electrical. What is this? I don't know about y'all. Having a sunburn makes me so freaking grouchy. Oh my god! I can't stand it. Yes, sun poisoning is a thing. Can dark-skinned individuals get a sunburn? Yes. Abso-freaking-lutely. I don't care how dark-skinned you are. Now, does it take them longer? Yes, it does. They have more melanin in their skin. They can still get a sunburn. Now, those of us that have of Irish descent, we can look at the sun and we get a sunburn. How deep does it go? Epidermis only. It's dry. What does blanchable mean?
Means you can press it.
Push down. Where do we hear terms like this? What other thing?
Oh, pressure ulcer?
Pressure ulcers. Guys, it's the same thing. If you think about it. Alright, partial thickness, second degree. What are the characteristics of a second degree?
The blistering or
Blistering.
blister.
That's it. That is the defining characteristics. Epidermis and the dermis. Now, are the blisters always intact?
No.
Y'all don't pop blisters. And you're gonna want to real bad until sometimes you be like, weak. Don't do it. Epidermis and what? For the dermis. Doesn't go deeper. Red, moist, shiny, fluid-filled vesicles. Now, does it hurt?
Yes.
Yes, it does. Can you have second and first? We ain't talked about third. Guys, you can have first, second, third, and fourth. You can have the whole spectrum of different types of burns. You don't just have one. But for a second degree or partial thickness, you have to have blisters. They don't have to be intact. They can have ruptured, but they have to have blisters. They are very painful. Full thickness. What's the defining characteristics of that?
The char?
Eschar.
Uh,
What about the skin though, if it's not eschar? What, it's non-blanchable, but how does it look?
white?
White, and they had another word that they used to describe it. Like a waxy look to it. It does not look like regular skin. Epidermis, the dermis, possibly the subq. It is dry. For the area that is third degree, it is dry. But what might be around it? Second degree. Now, what is this? That black. That's the eschar. And it really, it can look like cracked leather. Guys, that's what it is. I mean, it's burnt skin. Black, charred, eschar. non-blanchable. It doesn't matter how much you push on it, it's not gonna blanch at all. Trying to see, like, maybe that's the best, example of that white, waxy material. That's Escar. There. How about a 4th degree, deep, full thickness? It involves what?
Muscle.
Deep muscle, bone, tendon has to be exposed. All skin layers, tendons, bones, ligaments, and muscle. So here you see this bone. Now, what's here? That's 3rd degree, Escar. I know you probably can't see it, but there's some blisters up there. Their hand's completely gone. Bone. That's a huge blisters on their hand. Now, there's something about, they talk about 3rd and 4th degree about pain. Why do they say they don't hurt?
Because the nerves are.
They burned all the nerves off. But here's the thing, it's surrounded by what? 2nd degree, which hurts like hell. Yes, this doesn't hurt, but I have never in 25 years seen a 3rd degree burn. It's so hard for me to see these pictures. Trying to look here. That's a hinge tube. What'd you say? Now, this is pointing to the Escar that's there. These are the blisters, and that's not supposed to be pointing right there. That's supposed to be pointing to the red. These are the blisters. That's 2nd degree. 2nd degree. That black skin that's right in there, if it's charred, that's Escar. That's 3rd degree. Anything that's reddish is 1st degree. That was a blister, but it's gone. It's still 2nd degree. This just shows you it's not just one type. See, look at the fluid from where the blister has ruptured. Where is that burn? What's significant about that? Airway. As nurses, if you work on the burn unit, it's kind of different. I'm not gonna say you ever get used to it. I spent 2 months on the burn unit. You never get used to that. I hope you don't. But if you work on another unit, even in the emergency room, when they bring these burns in, what does that do to you? What does it got a lot of times if it's a bad burn? It's got shock factor, right? Like, it's really hard not to get, like, do that, oh my God. It's like the kid that got his foot caught in an auger. Y'all know what an auger is? And they had to reverse the machine to get his foot out. Like, it's really hard to not get caught up in that injury. The physical injury is awful to these people. But what else?
Mental.
If it is a bad burn, it is horribly disfiguring. How else do people get burns? Are they always accidents? Self-inflicted. Domestic violence. Yes, ma'am. They do. They treat huge abrasions from motorcycle accidents. There were 2 of them in the burn unit when I was up there. Now this is, I mean, like, you took a slide. Because, I mean, basically you've removed your layer of skin. Child abuse, where they would use cigarette butts, they would dunk the child in hot water, anything like that. So it is distressing for the family. It's also distressing for us to see those kinds of things. They do use skin graft up there, and that stuff was amazing. It was mind-blowing to me. They would use the patient's own skin. They would harvest it. They would use cadaver skin. They also would use pig skin to cover these wounds and to help with controlling the infection. What do you think kills most of these patients? Infection. You have completely removed their barriers. Y'all don't throw nothing at me. I found this morning and I thought this was awesome, and I don't like the one after this one. So, and this just basically puts it all together. Is the depth, how does the skin look, and does it hurt? Superficial, red, dry, blanches, sunburns hurt. Partial thickness, it's got blisters. I hate that word weeping. It just, well, y'all know I don't like that M word anyway. Very painful. Full thickness, leathery, dry, white, or charred. No sensation at the burn site. Their nerves have been burned. 4th degree, muscle, bone, black charred. No sensation. This is the one that's on there, and I have never liked it. I don't know why. For those of you that like visuals, this is just on there for that. So, total body surface area definitely contributes to severity. And when you guys were looking at this stuff, we started hearing about a burn center, right? When do you think we would send them to a burn center? Huh?
10 over 10?
Usually it's over about 20, but there's other things that would get you to a burn center. You were burned where? On your face, involving your airway?
Hands and feet, right?
Hands and feet. Why? You can't walk. You can't just say, I ain't gonna use my feet. Why your hands? You can't do your job. I can't pick up my children. You can't, I mean, you functionally might have just lost everything with your hands. Where else? Your genitalia. I mean, guys, Maslow's, besides, if you have a burn there, and you have burned like your urethra and you have urine leaking out, what did I say kills them? Infection. We had a young lady that was up there that was a seizure patient. She was cooking spaghetti. It was boiling. She had a seizure and knocked the pot off, and it landed on her chest and groin. There was nobody home with her. 2nd and 3rd degree burns over, probably would have been about 25%, because it was from here to here. But besides the infection, what goes right along with that? A psychological impact. Plus, I mean, it might destroy your reproductive ability. There goes your chances of ever having a family, right? The psychological impact of a burn cannot be overstated enough. I think I just went back. Oh no, not yet. how much of a body surface is burned? The rule of nines. What? What'd you say?
No, it's just the rule of nine.
I need to look back at the test, but I don't think there's a question. But every student I've ever had come back tells me that this is on the NCLEX. So you can not look at it if you want to. Guys, this is not hard. It's the rule of nines. It's, the front is how much? We're just talking about adults. How much? 18. Back is 18. Arm is 9. Arm is 9. The whole leg is 18. The whole leg is 18. Now, if the whole leg is 18, what's the front? 9. What if it's just that part of the leg? It's not hard. The head, 9. So, if you just, so this whole part's 18. So if you just have the stomach, 9. The general is just 1. So when we're doing this, do you think we over or under? Over. Bad. So, and I did not realize until last semester I had got this wrong my entire career. I thought it was the Palmer method. Well, it's the Palmer method. And I'm like, that don't make no damn sense. This is your palm. This ain't your palm. This is 1%. Now, why would I use this? For what kind of burn? For a small one, right? I mean, if you burn from there up, no. If you only have a very small burn, then I would use a Palmer method. Oh, just pick up your throat. So if it's just the palm of your hand, their burn. Elena's hand, if she's burned. Not my hand, because, let's see.
That's a big boy.
I mean, come on. There's definitely a little bit of a size difference there. So, I'm not going to use my hand to estimate his burn, right? The patient's hand, not mine. So, the whole hand is 1%, just the palm is 0.5.
Elena wants to know what about their hands are gone.
Oh, hell.
Oh, that's valid though.
Right? Yes. Oh my God.
But then how do you want to sound?
Hey, look what it says in 1%. Do you get like a little circle and measure? Oh my God, I've never thought about that.
I wasn't asking this, but she wants to know.
Let's type that in chat GPT and see what it says.
I'll do it. I'll do it. 1 second.
Let's see what it says.
Wait, nobody has ever asked it.
Let's see what it comes up with.
He's looking it up.
There's no Google search.
Is it gonna be like Alexa? What is that?
ChatGPT said that's a great question. It said use the palm of another person of similar body size. For emergency situations, use your own palm.
Look at that. So I guess you find somebody that was about that size.
In a more precise setting, like a burn unit or an ICU, you typically switch to the rule of nines or London Browser chart, which are more. Not trying to be cheating and it would be quick. I know,
So it always matters, location, 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 right? We've already talked about airway. What does functional mean? We've already mentioned this.
like
Hands,
feet.
feet, but there's something else that's functional, doesn't, and kind of hands and feet. What about joints? What happens when you form scar tissue? It tightens up. What happens when you don't move a joint for a while? You have contractures. Once you form contractures, that's it. They don't go back. Respiratory. The psychological effects. Head and neck. What is that? Airway. Face. Hands. Hands is also functional. Perineal. Functional, infection, and psychological. Now we're going to talk about circumferential. What does that mean? All the way around. Actually, we're going to talk about airway first. What's that in his mouth? Soot. What's wrong with his girl? He got a what's that? Fu Manchu? Is that what that is? Where it goes all the way down. His 70s porn star. Handlebar, yeah, whatever it is. He got all the way down. What's wrong with it though?
It's burnt off.
Can you see it? Oh, honey, it's like curled up. It's burnt. So, singed mustache. What else? Eyebrows, hair, eyelashes, anything. You don't have to have soot in his mouth or her mouth. Singed facial hair, burns anywhere on the face. Say singed nasal hairs. They have had heat on their face. You need to be suspicious that what? Airway is compromised. If they open their mouth and it looks like that, you need to think what? Guys, I cannot emphasize enough how quickly that airway is going to swell shut. Once it swells shut, what you gonna do? It's swollen shut. What you gonna cut into? You cut right here. It's swollen shut. They are going to die. There is nothing you can do. Where do you cut? You cut right here. It's swollen shut. You didn't intubate them early enough. And I don't care if you can get a 2.5 ET tube. You guess what size we gonna get? A 2.5. And guys, that's like this big. I don't care. I'm gonna go in there with pride. I'm gonna be strutting down through there with my 2.5. I don't care. Because you know what? That airway is secured with the only size I could get. Because if you don't get that, it is going to swell shut. Like, you're gonna come down and cut right here. I mean, I don't even know what you could do. I mean, maybe they could do something in the OR. But even from a flight nurse, like, you can cut here, but that's swollen shut. It's game over. But if I heard that, oh, give me the things, it's gonna be immediate. If I hear stridor, where's the swelling? Upper airway. Now, are you gonna see this? Yeah, that's kind of hard to see. That's in their trachea. What are you gonna hear there? Wheezing and maybe what? Crackles. So you can have a burn here, you can have a burn here, or you can have a burn here. How might their voice sound? Hoarse. this is an absolute emergency. Well, what if you're wrong? What if it doesn't involve their airway? Okay. What if Memo ain't having a heart attack and it's her reflux? Okay. What if it is? I don't know about y'all, but I don't want my Memo dying at home because it's her reflux and she's having a huge STEMI. She's gonna come back and haunt me. Singed facial hair, soot anywhere, hoarse voice, facial burns, nasal flaring, any sort of accessory muscle uses. They ain't got no problems breathing before, and now all of a sudden they do. You come in and they're like, they ain't got no COPD, no asthma, no reactive airway, nothing that affects their lungs, and now they can't breathe. Circumferential. If I have this entire arm burned, what is that circumferential burn going to electively turn into? On my arm?
Tourniquet?
Yes, ma'am. What's going to happen to my arm? It's going to die. And somebody said, what's going to happen inside there?
Oh, compartment.
Compartment syndrome. SCAR is not flexible. It does not give at all. So what do we do about it? Escharotomy. So, if the burn is here, it's circumferential, right? Where's the tourniquet? Right here. What are you not doing effectively? Breathing. I said this last time and I got some looks. This is the only... Y'all open a can of biscuits? I've only been present. We had protocols for this, only this. The patient's gonna die. You cut until it opens. You cut through the SCAR, and me and my partner, and the patient's dying. I think the last SpO2 was 68. So we cut until it popped open, and then praise Jesus, hallelujah, here we go. But that, you see what they did. They cut through the SCAR until it opens up. If you don't, that tourniquet is going to kill the patient. But here, where did they do it? It's at the leg. It's anywhere that it's circumferential. It has to be around that. Where else can it be? Fingers, they will do it here. Arms, anywhere that it's circumferential. So you can't see it, but he's got, where else? He's got it around his neck. You have to cut through that SCAR to get down to, I mean, I don't know if I'd call it healthy tissue, but you got to get, right. What happens in compartment syndrome? What's going on underneath there? What's building up in there? Pressure and toxins. What is the danger of that?
When it releases, when it goes, all the toxins go.
All those toxins, what? Flood the system. Now, is there really anything we can do about that? It's going to happen. We can pregame. How? Give them what? We start flooding them with fluids. We try to negate that. It's going to happen. You're right. You can't help that. We see it a lot with crush injuries, right? And the second you pull that off, it goes flooding through the system, and sometimes the patient might die. But you will give them IV fluids to try to help that. So, it's not just an escharotomy. Sometimes especially with a really deep burn. What is a 4th degree burn? Where does it affect? The muscle, fascia. I have problems with that word. So, we are talking about stuff to eat. Y'all ever cut steak and it's got that silvery, the sheath that the muscle is in? It doesn't expand either if the muscle is contained. If it's injured, all those cells swell. Well, what's going to happen? Compartment syndrome. So, that's what's happening here. It's got the muscles, the nerves, and the blood vessels that are contained within that. Blood flow is cut off. The pressure is getting higher and higher. It's just like what's contained underneath that eschar. But it's just the fascia here, and I'll show you the picture of it. See it? Right there, that silvery. And I know everybody that's in there has seen that on meat at some point. Where's my deer hunters? I know y'all have seen it. I had never cleaned a deer. I've been there when they're cleaning it, and I was like, that's gross. But there it is. What did they do? This is a lot deeper cut than eschar. Eschar is on the outside of the body. You see how deep they cut. You see how deep they cut. You have to get way down to the muscle. But look at this. That looks good, but look here. All of that is swollen and it's contained within that silvery sheath. If you do not cut into that, the same thing is going to happen. Fasciotomy, escharotomy. Kind of the same idea, a lot deeper cut, cutting through eschar. I'm not testing you on this one. Escharotomy will be on there. Circumferential burns will kill your patient. What do you think your nursing priorities are for these patients? Just general.
Airway.
Always airway. I mean, ABCs, right? So airway and breathing. Make sure that they're oxygenating. Make sure they're ventilating. Make sure air is getting in and out and round and round.
Oh, keep them warm.
Keep them warm. Every time we would pick a burn patient up, you knew you were going to be very uncomfortable by the time you got to Vanderbilt. I.e., has anybody ever been to the trauma bays at Vandy? How hot is it? Oh dear God, it's 85 degrees in there. You cannot let a trauma patient get cold. They will go into DIC very quickly and die. Your burn patient doesn't have any skin and they're soaking wet. They're gonna go into hypothermia and you can't get them warm. We would have the heater up into, oh my God, the 9th layer of hell hot. You've got sweat pouring off of you and their temp is like 86. They don't have any skin and all of their fluids is leaking out and you can't keep them dry. We would have, it's a hot pack it's like this big, for a neonate. But it was like, you break the little thing for a normal hot pack and had a little metal disc in it, but it was for a neonate. We would coat under these grown folks that had, it was years ago during a ice storm that we had in Kentucky, and her lights were out. She had a child. She brought a 55-gallon drum into the house, and they're going to freeze to death. And she got too close to the couch and caught on fire, and she covered her child. She was 80% third degree. She saved her baby. We flew her back. You couldn't get the heat any higher, and so we put those underneath her, like 3 of them. I think her temperature wouldn't get above 86. We couldn't, like the heat's as high as we could get it, 3 of those, I mean, as many blankets, the space blankets, there was nothing else we could do. The baby did survive, she did not. You have got to do everything. What else can we do to help keep them warm? Warm fluids. That don't mean go put them in the microwave. Why? You can't regulate that. Have y'all seen the ones in the hospital? That regulates the temperature. What kind of fluids do we use now? Used to, we didn't. Lactated ringers. We figured out it's not necessarily the sodium anymore that we figured out they don't need. What is it? The chloride. They don't need all the chloride. You are absolutely right. At first, what did all the naysayers say? Why did we not need to give them the lactated ringers? Oh, you're going to send them into what? They got all this lactic acid. You're just going to send them worse. Was that true? Absolutely not. It's got other things in it that's even better for burns. Lactated ringers, warmed. We need to know airway. We need to look at vital signs. We need to definitely stay on top of signs and symptoms of infection. During the acute phase, when they first come in, we ain't worried about infection signs and symptoms right then. That don't mean we ain't gonna worry about washing our hands and wearing gloves and stuff like that. ABG, CMP, CBC, chest x-ray. Fluids, antibiotics, topicals. Guys, pain meds. What kind of pain meds do we use for these patients? Yes. What kind? Dilaudid. Y'all throw some names out. Fentanyl. Morphine. Say it louder. Ketamine. What kind of drug is ketamine? Dissociative, sedative, hypnotic, amnestic, narcotic. It controls pain. It hits every single receptor, and it doesn't make you quit breathing.
14.
And it doesn't lower your blood pressure. I did clinicals in the burn ICU. Y'all know the first thing they do when you come to the burn ICU? What do we love to do down south when you get sick? Well, yeah. If you got a cough, honey, what's my mom gonna give you? So, a hot toddy. We're gonna give you some whiskey with some King Leo peppermint sticks. And if you got a burn, what we gonna give you? We gonna slather it with some mustard and some butter. Why butter? Oh my God! Let me just cook you right on up. Right? I'm like, what? Why butter or mayonnaise? Are you making a sandwich?
Yeah.
Really?
I bought the toothpaste. I burned my hand on like the iron ones. Yeah.
Now, aloe vera works. That is a true thing. There's one more that is, yes. Huh? Honey. Honey has antibacterial properties. That is a thing. Y'all throw me some other ones. I know y'all heard some other. There's one more that I was like. That chewing tobacco. Chewing tobacco works for wall stings. So that truly, the nicotine has counter like that.
Like aloe plant?
Aloe definitely works.
Chewing tobacco.
Imagine you burn your
So mustard, I've seen mustard.
Yeah.
So here's the thing, guys. All that stuff is all fun and games when it's a first-degree burn. Because guess what? Whatever you slather on, guess what we have to do at the burn center? You know how we take it off? You scrub it off. Y'all know them little scrubby brushes in the OR with all the little bristles? That's what we use. So they wheel them in this room that's called the hypo room. And this is a morbid. So they have these metal tables that are mortuary tables. Because it's got a hole at the end of it, and it is literally like 92 degrees in there. Everybody is dressed out completely for infection control. There are so many narcotics in there that I don't think I've ever seen that many meds. The patient is brought in, and they use chlorhexidine, those that are impregnated with chlorhexidine. Anything that's on the patient has to be removed. And I asked that nurse, because I had never been up there, I said, how much? I was given fentanyl and Versed. I said, how much do I give him? She said, until he doesn't remember my name. I said, he's going to stop breathing. She said, he won't. He was burned bad. She said, if he acts like he's going to start breathing, don't shake him, but just touch him on the shoulder. Why did she tell me to do that? It's going to... And he acted like he wasn't going to stop breathing, and I touched him, and he started breathing again. I don't even know how much fentanyl I gave him. More than I've ever given any other patient. Probably like 700 mics. Like... So what is the thing about medication and burns patients?
They're trying to require it.
Why? What are they doing? They are metabolizing it. That's important not only with narcotics, but what else?
Antibiotics. Oh, food. No.
It's a medication. I've got an airway burn.
Oh, like,
Oh,
like when you're gonna intubate them?
Yeah, propofol or
Yeah.
There you go.
Okay.
Do I want you snatching that tube out?
no.
Nope. I want you paralyzed. You burn through those paralytics twice as fast. What if you don't realize that?
They're gonna die.
And there's one of those paralytics that bless you. There's one of those paralytics that works better with a burn patient than the other. And if you don't know that, your patient's going to wake up and snatch out that tube that you really need them to keep. All of your meds, they burn through faster. Narcotics, paralytics, propofol wears off so damn quick. We ain't even going to talk about it like 2 minutes and they awake. Whatever the patient has on them that y'all have slathered on them has to be scrubbed off. This is where they also take pictures of the burns. Guys, burns can evolve. Just because it's 2nd degree right now, it can be 3rd degree later. Put the patient out. Now, if your patient has on that sexy plastic tracksuit and it melts to their skin, don't pull it off. If it is adhered to their skin, don't pull it off. Cold water on it. Not cold water. That makes it hurt worse. What does cold water cause? Vasoconstriction. It makes the pain twice as bad. Room temperature. Plus, when you pour cold water on them, what does that do to their temperature? Drops it. That don't mean don't put them out. Don't let them run around. Oh, look, they're on fire. No. Put them out. room temperature water.
Would you like cut off the garment as well as you
Cut
can?
around it.
Okay.
Don't pull it off. Anything that's melted to them. Don't. What else do you need to do?
Oh, jewelry.
Pull them rings off. It's going to hurt your feelings that that's great grandma's wedding ring. You can pull it off now or we can cut it off later, right? Take those rings off. Cut off restrictive objects. If you can't pull it off, you better cut it off or you're going to be losing your finger. What's the problem with that with the rings we have nowadays? They made out of what? Tungsten, titanium, super kryptonite, something. You can't cut it. I don't even know how you cut that stuff. I mean, do ring cutters work on those materials? I don't even know how you, I mean, the tungsten and titanium, they're so thick. I don't even know. I guess we need to ask ChatGPT. Do not cover these wounds with wet gauze. Why? You gonna put them into hypothermia. Dry. Well, what if you don't have, guys, they make burn sheets, and I got one upstairs, I meant to bring it down here. Well, what if you ain't got one? Put a what on them? A sheet or a blanket. Yes, their wounds is gonna leak out and it might stick to it. That's better than coating them with saline in a sheet. And now they're gonna be 20 degrees when they get to the burn center. If you don't have a burn sheet, just cover them with it. Do the best you can. Not wet dressings, dry dressings. Do not put ice on a burn. If you don't use cold water, you're sure as hell not going to use ice. That vasoconstriction makes the pain twice as bad. No salves, no home remedies, no nothing. Airway, breathing, fluid resuscitation, prevent hypothermia. What electrolyte specifically? Potassium. Pain management, wound care. You do not have to figure this out, but once again, it's on the NCLEX. This is how you figure this out. Do you think we give too much or too little? We give way too much. Now, there is a question on there. What do you think would be a complication of us giving too much?
Hypervolemia.
How are you going to figure that out? Edema and what else? Crackles. Now your patient can't breathe and they're sitting over there sounding like they're drowning. Alright, so from the time of their burn, 4 milliliters times what? Total body surface area times what? Body weight kilograms. 50% of it, first 8 hours. 50% of it, the next 16 hours. Now, let's say I got burned right now, and the ambulance picks me up, and they give me a liter of fluid. Where does that get figured in? You have to count it. If you're supposed to get 2 liters in 8 hours, how does that get counted in? I'm only going to get what? One more liter. Do you see how this gets us into trouble? Because I've been places before where they're like, oh yeah, EMS gave them 2 liters, but we didn't. So you gave them 2 more? Y'all don't give them no more for the next 3 days, okay? Especially if it's a child. intervention for major burns, IV, lactated bringers. Sometimes you will see them give normal saline at different hospitals. How do we know? This is important. How do you know it's working? Blood pressure goes up. 90 systolic. What map? 65. Heart rate goes. They're not showing signs and symptoms of shock. Lactic acid goes down. Urine output goes up. These are all the ways that we figure out that they're going back to where they need to go. Y'all got this question when we were talking about shock, right? This is just burn shock. You're evaluating whether your resuscitation was effective or not. It's no different than when we talked about every other type of shock. You do not figure out, oh yeah, I did the good resuscitation, my potassium came back down. That ain't worth a damn. Oh, yay! Your urine output ain't nothing. Your potassium's great, yay! No, you didn't resuscitate them. Your electrolyte balance is great. That's not what shows that you had a good resuscitation. That's what we base it on. I am telling you there's like 3 or 4 questions on these phases. This ain't rocket science. What do you think we do in the emergent phase? We save their life. ABCs. Stabilize the patient. Airway management. What's that say? Fluid resuscitation. This is the ABCs. Prevent shock. Don't go roll them through cow poop. Don't throw them into dirty water. IV resuscitation, airway management, intubation if you need it, oxygenation, 0 to 72 hours. You're taking care of the emergency. Now, the acute phase, 72 hours to wound closure. What did we say kills the patient? Infection. If the wound has healed, they ain't going to get an infection. 72 hours to wound closure. We are focusing on wound healing, preventing infection. Why is this so important on a burn patient?
Because they need nutrients to heal.
Let me tell you what, oh Lord. So when they were around at Vanderbilt, there was always, I don't even know what degree these people had. I've never understood the language they spoke. The amount of calories they gave these burn patients was unbelievable. And there's a medicine, and it's THC. It's what's the name of it? It makes them eat. It came in a pill form.
Come on now. Someone in here knows this answer.
I mean, guys, this was 15 years ago. They probably have a whole bunch of forms of it now. And look, if they said all they'll eat is ice cream and cake, guess what the doctor said? Then feed them ice cream and cake. I don't care. Now, if they had their preference, what would they like them to eat? Heavy proteins. Heavy proteins. Prevent infection. Support nutrition. We still have to do what? Because what are they doing during this time? They're going to start doing rehab. I'm sorry. That's the last rehabilitation. The wounds have closed. What did we say forms? Scars. Some people form bigger scars than others. Everybody doesn't do the same job, right? So, we're all gonna be a nurse. You go out, you hurt your back. You're gonna go do PT, or you have a triple level fusion, right? I'm still working for Lifelike. The last thing I had to do was take a 150-pound dummy and drag it around PT until the physical therapist was tired. And they were looking at me, and I'm like, is that it? She's like, no, I'll go around 3 or 4 more times. But that was the thing I had to do to make sure I could occupationally do my job, right? Occupational therapy, can we get you back to doing what you did as a career before? Is that always going to happen? Maybe not. Physical therapy, let's not let you form contractures. Scar management. Can you have surgery to make this better? Yes, you can. The NCLEX loves this for some reason. So does my test. Water-based lotions. Even on the burn unit, we ain't in the rehab phase. They would wrap the patient's legs with ACE wraps for a certain amount of time every day. And they would do exercises, range of motion, to help with swelling. These are just the complications: infection, sepsis, scarring, psychological trauma. You're not tested on this, but these are ulcers that specifically form with a burn injury. Every patient I saw up there always got what medication do you think? Pepsid. Pepsid, Prilosec, something along those lines. And when they got infections, it wasn't normal infections. If you have a patient with HIV and AIDS, what kind of infections do they get? Ones that what? Wouldn't hurt me and you. They would get some of the strangest infections up there that would not have hurt me and you. But why do we need to be thinking about that? We can spread things to them. It's almost, well, it is. It's like they're on neutropenic precautions all the time. They can't eat fresh vegetables, no flowers. It's exactly the same. They don't have an immune, their skin's gone, right? They don't have anything to fight infection at this point. Y'all realize this is the last lecture I have y'all, right?
Group hug?
So I know that y'all are tired of me preaching at you. Y'all gonna be nurses soon. And there's gonna be days that y'all gonna say, this is bullshit, I don't wanna be no nurse no more. I'm gonna go work in real estate. I'm gonna go get my dog walking. I don't know, sometimes I do like dogs. And when you get to that point, I want you to remember why you got in this in the first place. And everybody can say, how I got in this to help you. We did. But if I asked everybody in here, I'd get a different answer. You know, some people will tell me, for a family member, an event, or whatever. And there's gonna be days that you really need to remember that why. Because it's gonna be trying. This is not an easy career field, but it's a very rewarding one. And y'all better make me proud. I'm gonna whoop y'all. Any questions? When are we gonna do grand rounds?
Oh, I have a question. Swift River, the one that you just assigned, is it 4071 on there it says? Or?
Probably.
Is it like 8 hours, like 4071, 8 hours?
Yes. So the other one, so the ones I put on there make up for all of it. Make up for the sound that we missed. That's the emergency ones that we had. So you have to score a 70%, or it won't let you get out of it, I don't think. It should be, did it have a due date where it cuts off?
I just saw the 4071 I was gonna ask for.
There's just one.
The last one had a due date on it, but this one, the only one we see is the 4071.
So I opened up the ATI practice, the test back up. So, but guys, I've got to have a closing date because I have to go back in there and put the points and stuff. So I have to have a date that I can look at it. That's not May the 8th. But grand rounds will be the 23rd. Yes, ma'am.
Probably a stupid question, but you were having us do like extra stuff before an exam that was due the morning of, and then we kind of didn't have any more, and that gives us 10 extra points on our grade. How are you gonna go about that?
What are you talking about?
You were having us do like, they were like,
The ticket to test and stuff like that?
yeah, like those things.
I looked that up on ATI.
So it's
I've got a report that it prints out,
Okay.
so I put all that in.
Okay, but we haven't had them for like 2 weeks.
No, I know that
Okay.
I stopped giving them after like the third module. I do that every semester. I don't give them this like the first 3 modules.
And we didn't have it for the second module because we did the dosage calc, right?
All that stuff, like just because I didn't give it ATI, the other things count as the activities. Basically, it's participation. So just because it wasn't ATI, that doesn't mean you didn't get the participation points. I don't believe in just busy stuff. Is there anything else that we needed to talk about?
Did you open up the final eval Dropbox detail?
Yeah, I'll put one in there. Everybody, and if your instructor did not give you one, you need to write them an uglygram. Everybody has to have a final clinical eval. I know I've got some new clinical adjunct. They might not realize that. It is in your clinical shell, the blank form. You have to have a clinical evaluation. If your instructor does not know that, you need to let me know and I'll let them know that. It's not hard. I don't want them to just bull crap through it either. I will put the Dropbox in there when I get upstairs so you guys can put that in. Is there anything else that we're missing? Alright, what's today? It's Monday. Wednesday is research day, and then the next Monday is hematology, I think.
I thought that test was.
No, that's the other Monday.
This is Monday.
Wednesday we
We have a lot of those too.
and then research day?
Yeah, it's like from 2 to 4. Yeah.
2 to 4, yeah. Hematology is normal class time, research day, and then the test is the following Monday.